Faith Forward Media, this is Healthcare Musings. I'm Dr. Hashem Hasabala. Welcome to Healthcare Musings, everybody. Happy to have you with me. So, surgical consultation recommended. I can't tell you how many times I've seen that in a radiology report. And I have always felt uncomfortable with it. And the reason is it boxes me potentially in a corner from a medical legal perspective, right? So I remember one time there was a radiology report of a CAT scan of the chest. I'm a pulmonologist, and it showed findings of a lung mass, for example, in the airway. And in the report it says bronchoscopy recommended. Now, it potentially boxes me in as the ordering physician for that CAT scan to now do a bronchoscopy, which is an invasive procedure that has inherent risk on an elderly patient. And I could tell you, sedation, even in low doses in an elderly patient with lung disease, can be deadly. I have seen very low doses of sedation make people stop breathing. Or I have seen higher doses of sedation, when given by the anesthesiologist, induce undiagnosed sleep apnea in a patient, rendering him cyanotic and blue. So it just always frustrated me to see that. And I was having a conversation with a friend of mine who happened to be a radiologist, and I told him about this, and he gave me the story. He told me the story of when he was deposed in a lawsuit, and the lawyers kept harping on the fact that he did not recommend a neurosurgical consultation in his report, even though it was not clinically indicated, and that's not the point of the radiology report. The point of the radiology report is to tell me what the findings are in the image. What does the image show? And what could be a differential diagnosis, right? What could this be? What's this lung mass? Where is it? How big is it? What is it doing? And what could it be? If it's in the anterior mediastinum, for example, then it could be, one of those T's, right? A thymoma, a teratoma, a lymphoma, a T terrible lymphoma. So that's what you need to tell me, not mediastinoscopy recommended or biopsy That's not the role of the radiologist. And I mentioned that to him, and he told me this story that they kept harping on during the deposition, why he didn't recommend neurosurgical consultation. And so now, I understand it. For fear of malpractice, radiologists all over the place will recommend diagnostic studies, procedures, clinical consultations in the report. And that now just boxes in the ordering physician. If you have a CAT scan of the abdomen, for example, that shows free air, right? And that suggests perforated viscus, any clinician worth their mettle is going to call a surgeon. I don't need the radiologist to tell me surgical consultation recommended. Just tell me there is free air under the diaphragm, and free air under the diaphragm may mean perforated viscus. It could mean other things in the right clinical context. And that begs the question that does the radiologist have the clinical context? So if you have a CAT scan in somebody that just had surgery a few days ago, they may have free air under the diaphragm, especially if it was laparoscopic. That's important to tell the radiologist who is interpreting the study. And you know what? We ordering clinicians frequently fail to do that. We frequently fail to give the radiology colleague the clinical context of the imaging. And at the same time, again, making management recommendations in the report really puts us in a bind. And I was curious to know what Dr. Jeff Willis, who runs Expert Retainer, which is a firm that experts can sign up to be possible expert witnesses in malpractice cases, and he does pre-litigation review. I asked him about this phenomenon, about radiologists putting in the record for management questions for fear of malpractice, and this is what he said. Take a listen.
Hey Hesham, Jeff Willis here. Just wanted to give you my opinion on the concept of surgical consult recommended in radiology reports. I understand why the language gets used. It's a defensive habit, theoretically meant to cover liability, but the reality is that radiologists rarely have the full clinical picture. They don't really know what other tests have already been done, whether the patient has already seen a surgeon, or really what the overall clinical context looks like. So when a report just flatly says, quote, surgical consult recommended, it really puts the ordering physician in a bind. If the physician doesn't act on it and something goes wrong, it looks like there was clear advice that was ignored, even if a consult wasn't clinically appropriate for that particular patient. From a legal standpoint, that language can actually create more risk than it prevents. A recommendation in a radiology report becomes part of the medical record, obviously, and it can then be treated as part of the standard of care. So that means that the radiologist may actually unintentionally create a duty that they didn't necessarily intend, and the referring physician might be held responsible for not following through. It's similar to what we see with curbside consults, because even those can create a liability if there's any documentation that it occurred. In my opinion, the better approach is just clear, precise language that communicates concern without necessarily dictating ongoing management. So, for example, instead of surgical consult recommended, if they really feel like they need to put something in there, they could put something more like, these findings may have surgical implications. Further management should be, guided by clinical judgment, or something along those lines. Because this phrasing, it alerts the physician, but it respects the fact that the treating provider actually knows the patient and should decide what comes next. And in most cases, the best option is probably to just leave the recommendation out entirely. A radiologist's duty is to interpret the images and communicate the findings clearly, not to dictate further consultations or diagnostic workup. That's the responsibility of the ordering provider, who obviously has a more broad context of the clinical picture. And, so at the end of the day, our shared goal is patient safety, obviously, and really the best way to prevent a bad outcome and ultimately a malpractice claim is through thoughtful, collaborative communication, whether that be through radiology reports or, picking up the phone and making a phone call, because that's going to protect patients more than blanket statements that are written within the radiology report. Now, if they feel like they have to write something, a change in wording, I think is really important, and simply, writing surgical consult recommended is by far the worst thing that they can do.
Yeah, and I'm glad he agrees with me. I'm actually glad that he thinks that it's a bad idea. And so I'm not here trying to bash radiology colleagues. I'm not. And I sympathize. I wholly sympathize with the fear of malpractice. I have unfortunately been involved in a couple of cases. Thank God I was dismissed both times. The process is so painful. I still remember the day I got my first summons. My now 25-year-old was a baby. I was holding her in my arms. And they came to my door and they gave me the summons, and I opened up the complaint, and it made me out to be a murderer. I was an intern, not even a month into being a doctor when the case occurred. I get how painful that situation is. And he said, a lot of us do that because we don't want to go through that again. I get it. At the same time, we have to understand the implications of this kind of thing in a radiology report, and we have to work together to try to protect ourselves and at the same time not place your colleague at further risk of litigation. Thanks, guys, for your time and attention, and until next time, We'll see you on Healthcare Musings. Thank you for listening. Sign up at healthcaremusings.com to get every episode delivered directly to your email. And please don't forget to leave a 5-star review. Thank you so much.